We have putting forward a bill, Senate File 760, the second engrossment, the House version, that makes a great effort to focus on our priorities, live within our means, and have a sustainable program that will survive for the next decade and longer, as we care about the needs of the most vulnerable, seniors in nursing homes, and keeping the safety net intact. It is no small task to take a reduction of $1.65 billion and accomplish that, but I am quite pleased that after 4 months of work, we're able to unveil that bill today on the floor in a way that causes actually no harm to anyone that I can tell. We made provision for people with disabilities to get better management, to help them get focused care that will help them even become more independent. Safety net-wise, we've kept most of the MPIP programs intact. There's a strong safety net. If you're living in a group residential housing setting, we require that your building has an alcohol-free policy, which is helping people to move to more independence. We asked them to do some volunteer work, and just to show a little bit of moving along the path to independence. And so those folks are going to be very safe and actually encouraged to do better work. Seniors in nursing homes, the programs are fully intact. There's even some way for them to get a little bit of more money for their nursing homes so they can pay their staff a little bit better. And what else? Oh, and counties have more flexibility. We keep the county grants intact to do the necessary functions that counties have to do. We urge them to join service delivery authorities, which are groups of counties, so that they can function better. The metro counties are all big enough, but for more smaller counties to join together, we give them flexibility and their funding to accomplish the child protection, the waiver management, the disability services, the family services, the child welfare services that they have needed. There's much talk about reducing the CCSA grant, which is the flexible money the county has. The governor reduced it. Earlier versions of preliminary bills have reduced it. This bill does not reduce it by a penny. In fact, it keeps it totally intact. Mental health grants are fully funded because we know how important those are for the counties to work with those programs. And it has been no small task. We have received help from hundreds of citizens and individuals who have offered us advice. We try to incorporate that advice as we can, all the while managing our budget. A lot of resistance comes from people who don't want to change anything. To balance a $14 trillion deficit if they reduce some stuff now in a meaningful way. So to build our budget on more federal money, hoping to get this to match and stave off the inevitable, I think is not a good idea. And so part of why my target is so large, the largest ever in the Human Services bill, is that we put off decisions like this forever. The last 4 years we've had rate cuts, shifts of money, and even before that we've not made some of the decisions we should have made about looking at how we spend our money, what are we getting for our value. So it's been really a bipartisan effort to not address this, and now push has come to shove, and hopefully in a bipartisan way we can address this, and we're taking the lead to point out we need to make this so we can serve the people into the future that we care the most about. Keep our priorities straight, manage the money we have within our means, and make sure it's sustainable.